Okay, good morning, everyone, to the Wednesday, November 17th media briefing. We'll get right into the media questions, and today we'll start with CTV.
Good morning. I'd like to ask more about the quality of masks. I know this is something we've talked about quite a bit, but do you have any updated recommendations as more people move inside for gatherings?
Nicole, do you have the formal guidance of the Windsor-Essex Health Unit? I don't think we've updated we've not changed our position on masks for the latest guidance at the health district, but maybe Nicole can comment on that.
You're looking for, the formal guidance as people move indoors. It has remained the same. We would continue to recommend that individuals wear masks, especially indoors, and where 2 meters distance cannot be maintained. So that hasn't changed.
And I guess further on that, just the quality of different types of masks, whether it be cloth or just disposable, or maybe even like a refresher on what that is for people.
So, we would continue to just recommend, following Health Canada recommendations, cloth masks will be acceptable, making sure that it has the 3 layers. And so, that hasn't changed since near the beginning of the pandemic. We would recommend, again, that individuals wear a mask, and a cloth mask would be sufficient, as long as it has, the 3 layers of protection. And on our website, we refer to Health Canada for guidance related to mask use for the particular, if it's for a workplace, there may be differences certainly in the interactions and the type of work that they're doing, and different requirements. And we would refer, in that case, to Ministry of Labour or Health Canada for recommendations.
Okay, thank you. So switching gears to a sorry, Doctor, was there something else you wanted to add?
Yeah, because the reason we're cautious about saying this is we want to give advice that's entirely consistent with both the province and federal guidance. The first rule is wearing a mask is better than not wearing a mask. And so that's the real message. If you're indoors, wear a mask. If you're not going to be able to stay 2 meters away from somebody, wear a mask. Wearing a mask helps prevent the spread of COVID from, so those are all valuable constructs. Now, I know that the guidance has changed with the federal government from the initial part of the pandemic to now. And if you send us an email with some specific questions, we'll give you the latest guidance for what is recommended. But we want to give you the advice that's consistent with both the provincial and federal guidelines, recognizing the most important thing is to wear a mask and not what mask to wear.
Okay, thank you. I would like to ask a non-COVID question. Fluoride was supposed to be reintroduced in November. Have you received any updates? Has this happened, or is it happening? What's the latest with that?
So we will be requesting a formal update. You're right, our last official communication to our Board of Health was November. We will be requesting a formal communication related to the status of the reintroduction of fluoride. So, once we receive a formal communication to our unit, we'll be able to share that information. And as I said, we will be requesting a formal update. At this time, we don't believe that it has been reintroduced, but certainly have been waiting some time and are interested in that.
Okay, thank you.
Any questions from CBC?
Yes, I noticed there's a COVID outbreak associated with a public social event in Tecumseh. I appreciate that you can't provide identifying information, but any details you can share there? Is this a large outbreak? Was the event meeting the current guidelines? Any concerns there?
So there's not too much detail that we can share. Certainly anytime there's an outbreak, there are concerns. It means that there's a number of cases that are linked to an event, and that there was, transmission associated with that event. We are still investigating, so we wouldn't really be able to, at this point, share they're much more than that.
Yeah, if I could
Do you
also just supplement that, you know, what we're seeing right now at this stage in the pandemic is we're seeing clusters of cases related to social interactions or social events. So school exposure at school leading to other people at school being infected, to transmission to an athletic event or an athletic gathering, leading to a party or other type of festive event. We're seeing that now. So these are signals, preliminary as they are, that we're on an uptick of cases in Windsor-Essex, and it's particularly vigilant to stay the course and try to do our very best for containment. We recognize, I think everyone recognizes, as people spend more time indoors, you would expect to have a greater case count and greater burden of disease. But we want to try to have a manageable burden of disease so that we don't have to implement additional public health measures to bring COVID under control. It's important that people who, if we're going to try to keep public schools open and really work for that as a goal and try to keep as best as we can a normal community life, it's really important for people who are not vaccinated to get vaccinated. And there are probably more than 50,000 people in Windsor-Essex who could get vaccinated, who are eligible for vaccine, who've yet to get vaccinated. So sorry for being long-winded on that, but I just wanted to add that additional perspective.
Thanks very much.
Any questions from Blackburn?
Yes, as you may have heard, the Ontario government is considering allowing pharmacies to conduct symptomatic testing of COVID-19. I wanted to get your thoughts on that, Dr. Shanker, because I know that you tend to lean towards saying people need to go to assessment clinics and get the PCR test. Do you have any concerns about pharmacies conducting symptomatic testing?
Well, you know, how clinical services are organized is primarily a provincial responsibility, and I'm sure that the provincial officials weigh all the risks versus benefits. One thing I would always say is that if you are in fact symptomatic, you should get tested. If the province ultimately decides that the venue is going to be beyond assessment centers and to other areas, then we should take all the appropriate precautions to make sure that people who are symptomatic and infected with COVID don't transmit COVID to somebody else at a point of testing, be that an assessment center, physician's office, emergency department, clinic, or pharmacy. So to me, I think it's really at this point about the policy choice of should pharmacies be included. That's a provincial determination. And if it is, to make sure that all the precautions are put in place so that the site of testing is not does not lead to further transmission of COVID-19.
What kind of precautions do you think pharmacies should take to prevent transmission of a symptomatic case to others, perhaps in that store?
Well, it's substantively about first, there are a whole suite of interventions or suite of approaches, but among them is to make sure that you know that who's actually turning up at the site of service who's symptomatic, and then take the appropriate measures so that they can't transmit that. Wear a mask. The people providing the service wear appropriate personal protective equipment. Sort of the fundamentals of infection control, which I think can be effectuated assuming that the right amount of resources and planning are assigned to it.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Nicole. Good morning, Doctor. Doctor, based on what you're seeing in more recent cases, do you think that people are letting their guards down?
Yeah, you know, on an individual level, it's hard for us. It's hard for us to make that determination at the public health service. But at a community level, if we see increased cases, it's reasonable to infer that at a community level, there are opportunities to improve public health practices so we can effectuate containment. I recognize that it's inconvenient and sometimes burdensome, and not always the preferred option to consider some of the measures, which include maintaining social distance and wearing a mask indoors. But I think that we should be concerned that there are an increasing number of cases and there are increasing clusters. That's the worrisome part, is people are gathering, and during these gathering events, I would just ask, we would ask the Public Health Service to make sure that you're following the public health measures to prevent transmission at an event, even though the event may be permitted by the current provincial guidelines. It's still important to try to prevent transmission at these events.
Thank you.
Any questions from AM 800?
Doctor, just going off that question, with the higher case counts that we're seeing in our region, can you tell us, and I'm not sure if you can, but the cases that we're seeing, are those individuals that are vaccinated or unvaccinated? Can you share that kind of information with us?
Well, we are seeing cases among unvaccinated people and vaccinated people. From a public health or from a population point of view, if you're vaccinated, you're less likely to infect other people, get COVID and infect other people. We are seeing cases, though, in the vaccinated and the unvaccinated. Now, the people who are actually going to the hospital, going to the ICU and dying on a province-wide level are, for the most part, the unvaccinated. Although both vaccinated and unvaccinated people are getting infected, the people who are most being adversely affected are the unvaccinated at the current time.
And I guess with the holiday season approaching, more people are getting together, more parties, more gatherings. I'm guessing your message is the same, but what would you like to tell the public if they're starting to go to these functions?
Well, I think that if you're organizing, and I'm sure Nicole's going to supplement this, but first of all, if you're holding a holiday event, I think it's reasonable to ask the people coming to your holiday event to be vaccinated. I don't think anyone wants to have a Thanksgiving party or a Christmas party and have that to be the source of a cluster of cases and getting other people sick. And so asking people who are going to come to your house for a big party, if you're going to have that party, if you think that's important versus a risk versus benefit, then make sure that the people there are vaccinated. Now, I know this is hard, but to the best of your ability, it's better to have a party outdoors than indoors. If you're going to have a party, as best as you can, try to keep people 2 meters apart from each other. That's hard. But I think that as best as we can to try to limit the spread of COVID, we should work towards that goal, recognizing that it still remains an inconvenience and something that is something that I'm sure no one really would prefer if we didn't have the pandemic. Nicole, maybe you could supplement that in a more elegant way.
I think we would just say as well, everything that we do is still, it's as Dr. Nissathuri said, it's a risk, it's a decision around risk. And obviously our message has always been to reduce your individual risk as much as possible because it contributes to our risk as a community. I think the other important fact that are fully vaccinated, because we know that will significantly reduce the risk, but also screening, not forgetting screening. And certainly just reminding anyone to not to ignore symptoms. I think we're very focused on symptoms that are on that symptom list for COVID, but if individuals are sick in any way, if they have a sniffle, et cetera, the best choice for you is to stay home and skip that event. So that's, one message for sure that we want to make sure that individuals don't forget, as well as thinking about the number of gatherings or parties, et cetera, that you're involved with. So, just making those choices carefully and limiting your activity as much as possible. So certainly we understand, understand individuals want to get together with their family. It's been a very inconvenient couple of years, and but thinking, really carefully about, all of the activity and sort of those choices related to risk.
It's also worth repeating, if it's okay with my colleagues here, is that what we're really trying to do is break the chain of transmission. And the chain of transmission many times is from one person who goes to a party to another person who goes to a party, who interacts with perhaps their mother who's or father who's older, who then perhaps visits a retirement home, who then infects a vulnerable person, and you have a hospitalization and a death. And I think Nicole can correct me, but I think 450 people died of COVID during this pandemic in Windsor-Essex, if that's the right number. So it's just not about trying to prevent the individual from getting sick, although that's an important thing. It's also about trying to break the chain of transmission as we go forward. And those are at least one reason why we, the Public Health Service, try to advocate for limiting the amount of human-to-human interaction as we move through the holiday season.
Thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
Nope, I'm good. Thank you.
Okay. Any additional questions from the Windsor Star?
Yes, just one more. Looking at the health unit's website with the data page, you shared the risk of COVID-19 by vaccine status, as you know. Not too long ago, the risk of infection among unvaccinated was about 6 times higher than those who were fully vaccinated. That's dropped to about 3.5 now. Anecdotally, can you tell us, or do you know this information, are the fully vaccinated people who are contracting COVID catching it from unvaccinated people, or can you determine that?
Yeah, so this is really a risk. So I have to give you a nuanced answer on this. Empirically, it's the number of people, it's the likelihood of interacting with a person who's infected. And all things being equal, an unvaccinated person is more likely to have COVID than a vaccinated person. So it is likely that many vaccinated people contracted COVID from unvaccinated people. And probably from a risk point of view, that is greater. Now, what exactly that risk quantification is, that we can ask our epidemiologist about, and we can ask them to comment on that. If you send an email with that question, we can try to provide that. For any individual person who's infected, we probably will never know if they were exposed from an infected, a vaccinated or unvaccinated person. We can surmise it, but you can never say that with absolute certainty.
Thank you.
And any additional, go ahead, Nicole.
Sorry, I just wanted to add that it's important to note that the statistics and the risk ratio that's on our website, it changes because it's for a short period of time. And so, again, it's based on cases in a shorter period of time. I think it's like just a few weeks period. And so, and I know the province provides data, which is certainly a much greater and bigger, subset of our population. So just being mindful that 3.52 that higher on our website is just for a few weeks period.
Thank you both.
And finally, any additional questions from AM800?
Just one for Nicole, non-COVID question. Nicole, I know we talked about this last month in regards to the consumption site. Has that gone to council yet, or is it on its way to council?
So we had hoped actually to be going to council on November 15th, which is past. And we're not, my understanding is that the agenda was quite full. And so we've been pushed to December 20th. So our hope is that we'll be going forward in December to council for the support for the site.
Thank you. Just wasn't sure if I missed it on the council agenda, but appreciate that.
Okay. Thank you, everyone. And this concludes our media briefing today. We'll be back tomorrow at 8:30, and we will be having EPI summary presentation. Thank you.
Thank you.
All right.
Thank you.
Thank you.